Hello guys, I Dr. Virendra Kumar Gupta welcomes you at your YouTube channel for the medical student. So guys, today we will discuss about the very important topic which is growth of the child, and growth of the child is very important, and we will discuss here about the definition, assessment of the growth factors, rule of the growth, weight, height, BMI, head circumference, chest circumference, midarm circumference, bone age, how to calculate the dental age, etc. So guys, growth is defined as the increase in the size of organ of the and body, and growth is the quantitative changes and refer to the physical maturation of the body, while the development is the qualitative changes. So guys, you should keep in your mind this is the qualitative changes, quantitative this is. So guys, you keep in your mind this is quantitative changes, and physical maturation is the important side, and which can be calculated in the kilogram, length, in meter, etc. And the growth is the fundamental characteristic of the childhood, where the normal growth is the indicator of the optimal health of the child, and deviation from the normal pattern is indicative as the pathological process. And periodic assessment should be taken, and it has facilitate the detection of the growth filtering, which may be the first manifestation of the undernutrition, infection, or any disease pattern in the childhood age. So guys, fetal growth is started at the embryo, which is 8 week of the intrauterine life, to the birth or 14 week of the life, and while the period of growth is assessed as the prenatal period, perinatal period, postnatal period, and adolescent period. Where the prenatal period, there is the ovum is ovulation to the 14 days of the child, and embryo is called up to the 15 days to the 9th week of the intrauterine age, and fetus is 9 week to the birth of the child. And perinatal period is important, which is 22 week of the gestation to the 7th day after the birth of the child. And postnatal period is divided into the newborn or neonate, which is first 28 days after the birth. Infant is up to the 1 year of the child, toddler is 1 to the 3 year of the child, preschool age is the 3 to 6 year of age, and post-school child is the 6 to 12 year of age. And while the adolescent, prepubescent is the 10 to 14 year of age, and pubescent age is the 12 to 16 year of age, and post-pubescent is the 14 to 20 year of age. So guys, what factor affecting the growth is the genetic factor, which having the race, sex, chromosome, any nutritional factors which are the protein, energy, and minerals, and any hormonal factors which are the growth or thyroxine hormone. Environmental factor also affect as the infection, any trauma to the growing bones, or chronic systemic illness to the child or mother. Social factor in the parents' education, child education, or socio-economic class of the family, any emotional factors, and any seasonal variation. Growth is the continuous and orderly process which increase continuously and having different in different individual, and which may be unique. And differential tissue grow at the differential rate. As you can see in the graph, there is general body grows as a sigmoid pattern, while in the brain growth attain full growth at the 6 to 7 year of age, and lymphoid growth you can see here, this is highest at the mid childhood, which is 10 to 12 year of age. And guys, growth can be measured in the term of physical anthropometry, assessment of the tissue growth, any bone age, any dental age. So guys, age dependent anthropometries are the weight, height, length, head circumference, and the chest circumference, while the some anthropometries which is not dependent on the age, which is the midarm circumference, up to the 5 years of age it can be taken. Weight for the height, midarm circumference height ratio, midarm circumference head circumference ratio, Quelet's index, Ponderal index, Dugdale's index, and body mass index, which are not dependent on the age. So guys, we come to the one by one. is the weight is the one of the best criteria to assessment of the growth, and we will discuss here about the weight. That is the good indicator of the health and nutritional state of the child. But guys, keep in your mind, the weight is not an indicator of the nutritional state of the child. It may be different in the different child, and guys, it can be measured in the child. The child should be in the naked condition, or there should be minimal clothing, and sliding beam balance scale is the best scale, or electronic scale is the best scale. Before to taking the weight, the scale should be kept in the 0 position, and in the infant tray, the infant should be lie in the mid of the tray, while in the older children can be taken as the height in the standing position. And calculation of the expected weight can be done by the Veach formulas, which is up to the 3 to 12 month of age in month plus 9 by 2, and from 1 to 6 year of age it is 2x plus 8, and 7 to 12 year of age it is 7x minus 5 by the 2, where the x is age in the years. And normally the birth weight of the child is 2.7 to 3.7 kg. Around 3 kg is the normal for the Indian scenario, and less than 2.5 it is called as low birth weight, LBW. Very low birth weight is if the birth weight is less than 1.5 kg, or extremely low birth weight is the less than 1.1 kg of the child. And guys, weight gain is very important, and it should be continuous process, and initially up to the 7 days of the life it decrease around 10%, which regain up to the 10 days of the life, and 10 days to 3 months it increases at the 30 gram per day, 3 to 6 months is the 20 gram per day, 6 to 9 months is the 15 gram per day, 9 to 12 months is the 12 gram per day, and 1 to 3 years the 3 kilogram per year, and 4 to 12 years it increases as the 2 kilogram per year, and more than 12 years up to the adolescent age it may increase 5 to 6 kilogram per year. So guys, you can see that the weight gain is continuous process, but it decreases as per the increasing of the age, and again it may increase at the age of adolescent age. So weight gain is the sigmoid pattern, and birth weight is 2.5 to 3.7 kg, which is normal, and it double of the birth weight at the 5 month of age, and it triple at the age of 1 year, and quadruple at the age of 2 year of the birth weight, and at the age of 3 year it is 5 times of the birth weight, and at the 7 year of age it is around 7 times of the birth weight, and at the 10 year of age it is 10 times of the birth weight, which may be around 28 to 35 kg of the birth weight. So guys, in IAP classification, the weight of the age in percentage of the normal child for same age is more than 80%. In the IAP classification it is normal, and it is gradually grade 1, 2, 3 and 4, where the weight for the age is decreased as 71 to 80% for the grade 1, 61 to 70% for the grade 2nd, 51 to 60% for the grade 3rd, and for the grade 4 is the less than 50% for the normal child. And in the Gomez classification, the nutritional state is normal, where the weight for the age is the more than 90%, while the grade 1, grade 2, grade 3 classification on the basis of decreasing of the weight for the age as 15% for per degree, as the 76 to 90% is the grade 1, 60 to 75 is for the grade 2, and less than 60% is the grade 3rd classification. In the Balcom Trust is added the edema in the cases of where the weight is decreased for the age, and if the edema is present and the weight for the age is around 60 to 80% is kwashiorkor, and if the edema is absent, it is known as undernutrition. While the weight for the age is less than 60%, if an edema is present, it is marasmic kwashiorkor, and if the edema is absent for the less than 60% of the weight, it is marasmus. So guys, next parameter is the length or height. The increase in the height is indicated as the skeletal growth, and yearly increment in the height gradually diminishes from the birth to maturity as like the birth weight. The length can be taken less than 2 years of the age with the infantometer, while the height can be taken more than 2 years of the child with the stadiometer. And length can be taken in the lying position, and 2 people is required for taking the length, and head should be fixed in the vertical head on the board of the infantometer. It should be firmly press the knees together, and it can be taken around 0.5 centimeter to the nearest normal and up to the say 85 centimeter of the child. And the height can be taken with the bare foot, and feet should be parallel, and you should keep the child on the heel, buttocks and shoulder and occiput all should be touched to the ball, and head should be in the erect position with the eyes aligned on the horizontally. This is the Frankfurt position, and nearest height can be taken around 0.5 centimeter. So guys, for the increase rate of the height or length is birth to 3 months is 3.5 centimeter per month, and 3 months to 6 months is the 2 centimeter per month, 6 months to 9 months is the 1.5 centimeter per month, 9 to 12 months it is 1.3 centimeter per month. 2 year to 5 year it is around 6 to 8 centimeter per year, and more than 5 year of age up to the 12 year of age it increase as 5 centimeter per year. So guys, at birth length is around 50 centimeter, which increase as in 3 months up to the 60 centimeter, up to the 9 month of age it is around 70 centimeter, and 1 year it may be around just 1.5 of the birth length, it is around 75 centimeter, and it double at the age of 4 years as 100 centimeter of birth length. So guys, our next parameter is the body mass index, which is dependent parameter, and it is important criteria which help to assess the normal growth or its deviation as like malnutrition and obesity, and it measured at the weight in kilogram divided by the height in meter square of the body. So guys, normally the body mass index is the 18.5 to 24.9 kilogram per meter square, and below to that is underweight, and over to 24.9 is overweight, which is up to the 29.9, and more than 30 is known as obesity. So guys, next parameter is head circumference, which is related to the brain growth and development of the intracranial volume, and but to 18 years of age it increases, and it can be taken with the non-stretchable fiberglass tape as you can see in the picture, and it should be encircled at the most prominent part of the occiput. You can see the child where the occiput and supraorbital and frontal area. So guys, you encircle the tape around the head and with the most prominent parts, and accuracy of the head circumference should be around 0.1 centimeter, and in infant it is usually length in centimeter by 2 plus 9.5 plus minus 2.5 centimeter. So guys, gain of the head circumference is 0 to 3 months is 2 centimeter per month, 3 to 6 months it is 1 centimeter per month, 6 months to 12 years of age it is 0.5 centimeter per month, and 1 year to 3 years it is 1 centimeter per 6 months, and 3 to 5 years it is 1 centimeter per year. So guys, at birth it is around 3.35 centimeter, which may be at the age of 1 year around 45 to 46 centimeter, and at the age of 7 years it is 50 to 51 centimeter, which is very high and which may increase very slowly up to the 12 year of age, which is around 53 centimeter. So the next parameter is the fontanelle closure. At the birth, there are anterior and posterior fontanelle are usually present at the birth, and posterior fontanelle close at 6 to 8 week of the postnatal age, and anterior fontanelle closure later on the posterior fontanelle, which is around 12 to 18 month of the age, and early closure of these fontanelle may cause craniosynostosis, and late closure of the fontanelle may be due to the rickets, hypothyroidism, etc. And guys, next parameter is the chest circumference, which is an important parameter to assessment of the growth and nutritional state of the child. So guys, it can be measured at the level of the nipple in the mid inspiration position, and less than 5 years of age it can be taken in the lying down position, while more than 5 years of age it can be taken in the standing position. At birth, head circumference is 3 centimeter more than the chest circumference, because the surface area of the head circumference is very high, and growth of the head circumference is more than the chest at the age birth, while the head circumference is decreased up to the 1 year of age, and it may equal to the chest circumference, which may gradually decrease, and after the 1 year of age, chest circumference is more than the head circumference. So guys, next parameter is very important, is the upper segment lower segment ratio. Upper segment is calculated as the length between the buttocks to the pubic symphysis, and the lower segment is the pubic symphysis to the heel of the child. And the ratio is very important. It may be decreased in case of the rickets and other condition. And at birth it is 1.7:1, which is highest, and it decreases gradually, and at the age of 10 years it is around 1. And next parameter is the arm span. So guys, distance between the two middle finger or middle finger of the both arm, if we stretch the hand at the right angle, we can take the arm span. And less than 5 years of age, it is 1 to 2 centimeter less than the height, and by the age of 10 to 12 years, it become equal to the height. And after the 12 year of age, the arm span exceeds the height, but what difference is less than 3 centimeter only. And next parameter is the MIDARM circumference, which help to assess the nutritional status of the younger child, and it is age independent criteria, where it can be measured in the left upper arm at the midway between the acromion and olecranon process, and the arm should be in the hanging position at the side of the body. It can be taken with the Shaki tape, Bengal's test, and at birth it is around 9 to 11 centimeter, and at the age of 1 to 5 year of age it is around 16 to 17 centimeter. And in the Shaki test or Bengal test, there is some color coding, where normally it is more than 13.5 centimeter, which is measured in the green, and 12.5 to 13.5 it is borderline MIDARM circumference, and less than 12.5 is known as undernutrition, which is in red color in the Shaki tape. So guys, next parameter is the weight for height, which is calculated as the weight of the child in kilogram divided by the expected weight of a healthy children of the same age, multiplied by the 100. So guys, it is classified as the normal, which is more than 90% of the weight for height, and mild wasting is the 80 to 9% of the normal, and moderately is the 70 to 79%, and severely it is less than 70%. So guys, WHO classifies as the weight for height is, and on the basis of the Z score, if it is less than -2, it is moderate fasting, and if Z score is less than -3 is severely bursting. While the height is for the age is in the Z score is less than -2 is the moderate stunting, while the Z score is -3 for the less than -3 for the height for age is the severely stunting. So guys, next parameter is the bone age, and it can be calculated as the appearance of the ossification center and can be taken by the X-ray study, and up to the 8th year of the age, bone age can be calculated by the carpal bone of the left wrist, and it is around age is around the number of ossification center which are seen in the X-ray -1. Like if the 3 bones are ossified in the wrist, the age of the child is around 2 years. 5 bone is the 4 years. So guys, it is calculated in the up to the 8th year of age, and normally in newborn, X-ray can be taken for the knee or ankle. 3 to 9 months of age, shoulder X-ray can be taken up to the 3 year of age. Wrist is very important, 3 to 8 year, and 12 to 16 year of age, elbow or hip is the best X-ray to calculate the bone age. Guys, in the elbow you can see here, there is you can keep the manomix as the cretol, which is 1, 3, 5, 7, 9 and 11 year of age, as the capitellum, radial head, internal epicondyle, trochlea, olecranon and lateral epicondyle. So guys, next parameter is the dental age, which is there is a multiple variation for the dental age for the time of the eruption of the teeth, and first teeth usually commonly appear as the lower central incisor, and which may appear around 6 to 7 months of the age, which can be delayed around up to the 15 month of the child in the normal range of the child. So the dentition is not dependable parameter for the assessment of the growth, and there is 2 sets of the teeth, which is the temporary teeth and permanent teeth. Usually the teeth in the upper jaw is erupt earlier than the lower jaw, except in the lower central incisor, which appear first. In the temporary teeth, at birth there is no teeth. At the 6th month of age, lower central incisor is erupted. At the age of 7 months, upper central incisor and lateral incisor up to the 10 month of age. 12 to 15 month of age, the first molar, then canine up to the 21 month of the age, and at the age of 2 years, second molar is appear. So almost all temporary teeth appear up to the 2 year of age, and permanent teeth is erupted started at the age of 6 years as first molar, and at the age of 7 to 8 years, central and lateral incisor is erupted. At the age of 9 year, first premolar, second premolar appear at the age of 10 to 11 year, canine 11 to 12 year of age, second molars 12 to 13 year of age, and third molar appear lastly 17 to 22 year of age, and it may later on. So guys, it was all about the growth. Guys, how was the class? And if you did not subscribe our channel, please subscribe the channel and press the bell icon to get our notification first, and share to the all students who need it and preparing for the NEET, USMLE, DNB or other in medical examinations. So guys, we will meet again with the next topic. Thank you.